Are you a nurse preparing for the NCLEX? With our new course, Master the Next Generation NCLEX in 21 days, you'll gain the tools, the strategies, and the confidence you need to pass the NCLEX and achieve your dream of becoming a nurse in the United States. What makes this program unique? Results, efficiency, proven strategies, all designed to save you time and accelerate your preparation. Inside the course, you'll get content mastery videos, clear step-by-step lessons on essential nursing concepts, critical thinking development series, so you can think exactly how the NCLEX wants you to. Advanced strategy tutorials, insider methods to crush next-gen questions with confidence. 180 days of access, 6 full months of flexibility. Study when you want. An 85-question pre-assessment, so you know your strengths and weaknesses from the start. An 85-question post-assessment, so you can measure your progress before the big day. 14 mini-exams, laser-focused practice on the most important nursing topics. A one-on-one private coaching session, your personalized game plan to pass the NCLEX. With Master the Next Generation, NCLEX in 21 days, you are not just studying, you're training strategically to win. Don't let anything stand in your way. Enroll today and take the first step toward transforming your future. Master the Next Generation, NCLEX in 21 days. For those who believe all things are possible.
Hello, hello, hello. Welcome, NCLEX Crusader. Let me know if you can hear me. And for those who are in our YouTube channel, you can see the presentation. Thank you for joining today's live training. We are here continuing with our pharmacology training. NCLEX critical thinking time with the topic of pharmacology. And in today's episode, we're going to talk about digoxin. Do we give digoxin or do we hold it? What are the parameters? So that's going to be the topic of today's training. Let me know if you can hear me. Please comment in the comment section and of course share. Share this episode with anybody you know that is preparing for the NCLEX. So imagine you are providing care in a cardiac telemetry unit and your patient's heart rate drops to 58 beats per minute. They start feeling nauseated. Do you give digoxin or do you hold it? So these are the type of questions you will encounter on the NCLEX, and you have to know how to answer these types of questions. Stay until the end, because at the end I have a very good news about our upcoming new masterclass. It's going to be completely free on Zoom. So if you are interested in learning more about that masterclass, I will be sharing some details later on at the end of today's training. I want to say hi to everybody that is joining us here on TikTok. Nice to have you here. Thank you for sharing all those beautiful comments in our videos. It really means a lot. So I will continue to provide quality NCLEX preparation training in all of our social media. So welcome once again. Let me look here at the comment section. Very good. Everybody can hear. Excellent. Very good. All right, well, let's begin today's training. Like I said, with the topic of pharmacology, specifically today about digoxin. Remember, if for some reason you missed last week's presentation, it was the first episode of our pharmacology training, and it was about the strategy of critical thinking. When do I know if I can give a medication or hold the medication? You can find that in our social media, NCLEX Crusade International. We are doing a several days training on pharmacology, so do not miss any of today's training, last week's training, next week's training. So make sure you are following us in our social media, okay? Very good. All right, so today's objective. First, I want to review with you therapeutic range and holding parameters for digoxin. Number 2, recognize early versus late symptoms or signs of toxicity. And of course, we're going to do some critical thinking practice questions that I know that you guys love to do. So let's continue and let's begin talking about some topics of digoxin and safety on the NCLEX. As you know, pharmacology is a big topic on the NCLEX. It represents a big percentage of NCLEX questions. Some students get 10 questions, 10 pharmacology questions. Some students get 20, 30 pharmacology questions. It all depends on the exam that you have. So I want to know. So those who are reviewing or looking at this live now, if you've taken the NCLEX before, how many pharmacology questions did you get? Let me know. I want to see in the comment section. Did you get 5, 10, 15, 20 pharmacology questions? What can you say? Thank you, Professor Melanie. I passed the NCLEX. When the first attempt, Melanie, was it the first attempt? Okay, I see here 11 questions. Wow, that's pretty good. I remember back in the days, in my NCLEX, I got like 40 questions. I don't know why I got so many pharmacology questions, but I did. And they were all very, very difficult. So let me see, who else? Melanie, yes, it was the first attempt. So congratulations, Melanie, on passing the NCLEX. Thank you for coming back and to let me know. I only got a few. I see somebody here questioning, mentioning 5, only 5. Okay. Anybody else? About 10 questions. Okay. Indra, thank you, teacher. I passed the NCLEX with 85 questions from Mexico. Wow. TikTok is on fire with all these passes here. Very good. I'm so happy when I see this. This is very, very good to hear. Thank you. Thank you for sharing. Thank you for coming back. Okay, so I see about 5, 10, 15 pharmacology questions. Very good. Okay, so now we know that it is important. So let's continue with today's topic, digoxin and safety. When we talk about digoxin, one of the first things is that you need to know the therapeutic range for digoxin. So when you are administering digoxin to a patient, what is the therapeutic or therapeutic range? 0.8 to 2.0, that is the therapeutic range. Number 2, what are some holding parameters? Holding parameters, you need to know. 1, if the heart rate is less than 60 beats per minute in an adult. We're talking about in an adult because a pediatric patient is different. I'm not going to talk about pediatrics today. I'm going to focus pharmacology and adult. Holding parameters for digoxin. Heart rate less than 60 beats per minute. Symptomatic bradycardia, or if the therapeutic range, if the medication, when you give the medication and you do the blood draw, the result is above 2.0, that is therapeutic range, a parameter to hold. If the issue is the heart rate less than 60, then that is another holding parameter pertaining to the heart rate that you need to remember. Now, this is very important. We need to talk about toxicity because digoxin is a very serious medication that frequently we can see toxicity in our patients from digoxin. And the reason is this. So you may ask, why do I need to worry about toxicity specific with digoxin? Because there are certain conditions that can increase the risk of digoxin toxicity. For example, if a patient has hypokalemia, let's say from administration of diuretics, a loop diuretic, thiazide diuretic, if the patient develops hypokalemia, low potassium level, that increases the risk of digoxin toxicity. If the patient have hypomagnesemia or hypercalcemia, that also increases the risk of digoxin toxicity. Of course, the medication is excreted renal by the kidneys, so we have to worry about renal impairment. If a patient develops renal impairment or has a condition where there is renal impairment, that increases the risk of digoxin toxicity. Another thing that you need to remember, and it comes in the NCLEX, or you will see in the NCLEX very frequently, is identifying or seeing what is the difference between early and late signs of digoxin toxicity. So early signs, remember, nausea, vomiting, anorexia, fatigue. And late signs, remember, vision changes, yellow halos, confusion, and arrhythmias. But of course, this is just some basic knowledge, basic content with regards of digoxin and safety. But as you know, I am passionate about critical thinking. I consider myself a passionate person about critical thinking, prioritization, understanding why, because that will make a difference the day of your exam. Many nurses make the mistake that they only learn things by memory, but they don't dedicate the time to ask why, to use that critical thinking muscle to answer NCLEX questions. And if you only go with content to the NCLEX, you only are bringing half of the tools to answer the NCLEX question you will see the day of your exam. So let's go through some critical thinking exercise. So I'm going to give you some scenarios, okay? So listen to these scenarios. I will describe a very particular scenario, and then I'm going to ask you, based on this scenario, would you give the digoxin, or would you hold the digoxin and notify the healthcare provider? So are you ready? Let me know if you're ready. If you're ready to participate in this critical thinking scenario, comment in the comment section, I am ready. And let's see if you get all the questions right, okay? So let's do a little competition here. Let me know if you get it right. Put 1 of 1, 2 questions correct, answers, 3. Let me know how you're doing. Okay, I see some people here ready on TikTok. Anybody else ready? All right. Ready. First time joining a live, exciting. Well, welcome Dorcas. Welcome to today's live training. Very good. Ready. Excellent. Let's do it. All right, so you have a scenario number 1. The doctor's orders digoxin 0.125 milligrams PO. When you check the patient's vital signs, these vital signs are given to you. Heart rate is 62, but you get the information within the data that the patient's heart rate is 62 and irregular. You get some lab values returned, and the potassium is 3.2 milliequivalents per liter. You talk to the patient, and the patient reports poor appetite for at least 2 days And the patient also reports intermittent nausea. So what do you think? Do we give, or will you give the digoxin, or are you going to hold it and notify the doctor? What do you think? I see here, nope, hold it. Okay, hold. Anybody else? Hold the medication, notify the doctor. These are showing signs of toxicity. Lesky. Thank you, Lesky. All right. What is the answer? Yes, the answer is to hold the medication. We're going to hold and notify the healthcare provider. Now, why? So let's think about it. Because we talked about that the holding parameter for the heart rate was less than 60. And the heart rate in this first scenario that I am presenting to you was 62. But there's something else. The heart rate is irregular. This is an important description. Also, the potassium is low. And I told you that you have to keep an eye for hypokalemia, because low potassium increases the risk of digoxin toxicity. So 3.2 potassium, that's low. That worries us. Also, the patient reports anorexia, poor appetite, with intermittent nausea. These are early signs of digoxin toxicity. So why do I hold and notify the doctor? Because although the heart rate is normal, is irregular, the patient has hypokalemia with early signs and symptoms of digoxin toxicity. The correct answer is to hold and notify. Good job. All right. So if you got it right, you got 1 point. 1 out of 1. Good job. Yay. Let's see if we can keep that track record. Let's go to this scenario number 2. Scenario number 2 says, now the doctor's order is to administer digoxin 0.25 milligrams PO. The heart rate is 74 beats per minute. The digoxin level, when they do the lab draw, is 2.3. And the patient complains of new onset of blurred vision, but denies chest pain. The potassium level in this scenario is 4.1 milliequivalents per liter. And you have to identify, do you give or hold and notify the doctor? What do you think now? I see hold. Why? Why are we holding? It's important. Remember, not only the answer, but why? Why are we holding? Okay, great. So we are holding because the digoxin level on the blood draw is 2.3, which is above the therapeutic range. So this is one reason. And also, there is a new onset of blurred vision. Blurred vision is a classic late sign of toxicity. Now, in this scenario, the heart rate was normal, the potassium was normal, but the digoxin level was abnormal, and also the signs and symptoms. So this is why you need to look for these parameters, like I told you at the beginning of today's training. So if you got it right, comment you got it right, and let me know who's 2 for 2. We've done 2 critical thinking scenario. Who's 2 for 2? Diana, 2 for 2. Bella, 2 for 2. All right. In this scenario, absolutely. In this scenario, absolutely. We're going to hold and notify in this scenario. And Lesky is commenting here, gotta know when we're dealing with expected signs and symptoms or adverse effects. Correct. Yes. Good job, Lesky. All right, let's do another scenario. In this scenario, the order is to administer digoxin 0.125 milligrams PO. The heart rate is 68. The digoxin level is 1.6. And there is a new level, creatinine level of 2.1 milligrams per deciliter. The patient has a baseline of 1.0. And the patient is mildly fatigued, or the patient reports mild fatigue. What do you think? What do we do? Do you give or do you hold and notify? This got a little bit more interesting. Now the crew is divided into give, or some of you are saying hold. Shayla's saying give. The heart rate in this one is 68 beats per minute. Digoxin level 1.6. Creatinine level 2.1. Tricky one, huh? Yes, it is. It is tricky. NCLEX style. Just like the NCLEX like it. Very tricky. I see somebody saying, I'm lost. All right, you're going to learn something new today. This is good. All right, heart rate is normal. Remember, 60 to 100 is normal. If the heart rate is normal, that is a good parameter. Digoxin level, 1.6. But we have another value. We have creatinine level that is 2.1. I ask you, is that normal? Is a creatinine level of 2.1 normal? Is that normal? No, it's not normal. So, what did I say at the beginning of the presentation that was one of the reasons to monitor and be careful with toxicity in what kind of patients? In patients with renal problems. Now, we don't know why the patient's creatinine level is 2.1. We are not getting enough information. This is just a simple scenario. But you have to know that if the patient's creatinine level is elevated, we have renal problems. And if the kidneys are not working well, that increases the risk of digoxin toxicity. Therefore, just with this information is enough to hold and notify the doctor. Hey doc, I see the order for digoxin, heart rate is okay, digoxin level is okay, but we got renal compromise here, creatinine level 2.1, when the baseline of the patient is 1.0. So we have a creatinine level almost 100% higher than the baseline. But then also, they're giving us here that the client is reporting mild fatigue. So mild fatigue along with a elevated creatinine level, this worries us about possible toxicity, although the digoxin level now seems to be okay. We have enough information. The safest approach will be to hold the dose and call the doctor. Maybe we can give the digoxin, but at a lower dose. We have to get it with the doctor. So how many of you have 3 of 3? Like 100%. How many of you? All right, Amanda, 3 of 3. So let's get correct. If the creatinine level is elevated, abnormal is another parameter to hold digoxin. So far we talked about bradycardia, heart rate below 60. We talked about hypokalemia and also renal impairment indicated by an elevated creatinine level. Hi to you, sir. Brandy, 3 of 3. Okay, so some of you, 1 of 3. So we have to improve a little bit there. 2 of 3. We got to improve that as well. These are not too difficult questions. It's just some critical thinking scenarios. So yes, anytime you hold a medication, of course, you have to do a documentation that you held the medication and notify the doctor. Correct. The doctor will determine if the dose will be changed to compensate or just hold it all together and wait for another drug. All right, so let's do another one. And this is a little bit more difficult. So I try to go from least difficult to more difficult. So I know you're not able to see, some of you are not able to see the presentation because I'm sharing the presentation live, but some of you on TikTok are not able to see the presentation. I'll talk about that at the end. 72-year-old client with chronic heart failure is prescribed digoxin. The nurse is reviewing the client's assessment findings. Categorize each finding as either an expected effect of digoxin or an adverse effect of digoxin. So this is one of those next generation NCLEX style of question where they give you assessment findings and you need to identify if the findings are expected or unexpected adverse effect. So I'll go one by one And you tell me in the comment section if you think it's expected or adverse effect. All right? Are you ready? So let's go. Number one finding, assessment finding is you take the patient's heart rate and you see that the heart rate dropped from 88 to 68 beats per minute. Is that expected or is that an adverse effect? So number one, expected or adverse effect. Okay, I'll talk about the answer at the end, the rationale. Let's just go one by one to make it easy. Okay. Finding number two, improve exercise tolerance and reduce dyspnea. Finding number two, improve exercise tolerance and reduce dyspnea. Is that an expected effect or is that an adverse effect? Okay, number three, nausea and poor appetite. Is that expected or adverse effect? Number four, seeing yellow and green halos around lights. Expected or adverse effect? Irregular apical pulse and a 48 beats per minute. Expected or adverse? And finally, increase urinary output with decreased ankle swelling. Expected or adverse? So let's go one by one. What are the expected effects? Well, decrease heart rate from 88 to 68 beats per minute. This is an expected effect from digoxin. Remember that digoxin has a negative chronotropic effect. So a decrease in the heart rate is the result of the negative chronotropic effect of the medication. Improve exercise. Improve exercise tolerance. Reduce dyspnea. This is evidence of better cardiac output. So this is good. Increase urine output with decreased ankle swelling. This is also an expected effect, and it indicates that there is improved renal perfusion. Very good. If you answer that, we are good. Let's talk about the adverse effects. So nausea and poor appetite. So we're talking about gastrointestinal irritation, one of the earliest signs of digoxin toxicity. Seeing yellow and green halos around lights. This is a classical visual disturbance linked to elevated serum levels of digoxin or toxic serum levels of digoxin. Irregular apical pulse, 48 beats per minute. This is a bradyarrhythmia. So this happens when there is suppression of the atrioventricular node conduction. Also, notice the relationship between answer number 1 and answer number 5. There is a relationship there. We said that number 1 is good, is expected, because the heart rate is normal. But when we look at answer number 5, irregular apical pulse, and a heart rate of 48, bradycardia, well, there's a difference there. Usually, when you see these type of questions, or even in Selecto that applies, and there are two answers that are opposite to each other, usually one is right and the other one is incorrect. Also, in this case, one is expected and the other one is unexpected or adverse effect. Okay? So, remember, to summarize, digoxin enhances myocardial contractility. Digoxin slows conduction through the AV node. So what happens when you slow conduction through the AV node via medication? Is going to lower the heart rate and improve symptoms of heart failure. Patients that were having difficulty with exercise, now they can tolerate exercise better. However, when we see gastrointestinal symptoms, visual disturbance, arrhythmias, these are hallmarks of toxicity. So as a nurse, identifying these adverse findings basically ensures early detection and prevention of life-threatening complications. And for the NCLEX, well, it represents that you're going to pass if you answer good questions. So, who got 4 out of 4? 4 questions right. Who got the maximum points? Okay. Janti. All right. Anybody else? All right. So let's recap before I talk about that surprise that I wanted to share with you. So when you're dealing with a question about digoxin, administration of digoxin, remember, there are certain things you need to analyze. Heart rate. Is the heart rate between 60 and 100? If we have bradycardia with irregular rhythms, then we need to worry about adverse effects, toxicity of digoxin. Monitor electrolytes, especially potassium. Hypokalemia increases the risk of digoxin toxicity. Monitor renal function. What is the creatinine level telling you? And of course, we have to look at the therapeutic range of digoxin. Okay? Remember, you have to analyze all these parameters together, not only one. You have to see how the patient is doing. Whenever you see a cluster of GI symptoms, nausea, anorexia, and also you see electrolyte imbalance with heart complications such as bradycardia, symptomatic bradycardia, you need to think about digoxin toxicity. If you see neurological symptoms, confusion, yellow, halos, blurred vision, this will signal of advanced toxicity requiring an immediate action. This is an emergency and requires an immediate intervention. If you are preparing for the NCLEX, I have a master class for you that you cannot miss. September 12th, 7 p.m. on Zoom. I will give a master class completely free on Zoom where I will teach you about the next generation NCLEX I will teach you about prioritization, critical thinking. What are the abilities that you need to develop to pass the NCLEX? Completely free. We'll be on Zoom. You will have the opportunity to ask questions. I will be there with you answering questions, how to study, a proper guideline to use, a proper study guide to use, what is a good question bank, all those questions. You will have the opportunity to ask me, and I will provide the answer to those questions. All right? So, but in order to attend the masterclass, you need to register. So I'll give you some instructions on how to register for this free masterclass. Remember, September 12th at 7 p.m. So I'm going to ask my advisor to put her number here in the comment section. Lizzie, can you put it on TikTok, please? Yes. I'll give you the advisor number so you can contact us. So we can give you the link to register. Also, if you are on YouTube, I have provided the link in the description, in the video description. And if you're watching this on YouTube, on TikTok, I am not able to share the slides here on TikTok. But as we're live here on TikTok, we're also live on YouTube. In our YouTube channel, you can see the whole presentation. Okay? And also the link. So, now you know, masterclass coming. Don't worry, we're going to continue to provide information about the masterclass. All of you are invited. All you have to do is to register so you can attend that live masterclass. Do not miss our next pharmacology training next Friday, same time, 5 p.m. I will continue providing more NCLEX training here in our social media so you can continue preparing for the NCLEX with us. Okay? Okay, I'll put the link as well. Let me put it here. Okay, so I'm gonna try to share it. Did you share it on TikTok, Liz? Mm-hmm. Okay, perfect. Okay, so here it is. I'm gonna share it here as well. Okay? All right, so who's going to the masterclass? Who's gonna be there? Let me see. Who's gonna be there? This amazing free masterclass, NCLEX preparation. It's going to be amazing. It's going to be very good training for you. Who's going to be there? Natalie is going to be there. Ceci's going to be there. Jadi's going to be there. Let me put the number here to our academy because I see some of you are asking for that. I'm using this new thing here. I don't know how to...
Put the number also.
Yeah, put the number also, please. Well, I don't know how to do it now, but...
I did it.
You did it? Okay, perfect. The link, our YouTube channel is NCLEX Crusade International. Just search that up on the YouTube, and it will come up. All right, Jessica, can you explain the master class? So Jessica is asking about our new course, Master the Next Generation NCLEX 21-day course. So Jessica, that is a on-demand course. It has about 90 videos. It's a composite of many trainings that we've given live in the past. There are prioritization strategies, critical thinking process, content videos, practice questions, a lot of good information. I'm going to talk more about on the masterclass as well, so you can get more information. But anybody that have to take the NCLEX sooner and you want to join our 21-day masterclass, basically we have that new course. It's called the Master Next Generation NCLEX in 21 days. It's a very fast-track course for any students that are taking the NCLEX within the next 3 weeks. Contact our academy, speak with my advisor, Cici Eleni, and we will help you. Be careful with scammers. Okay, I forgot to mention this earlier. Be careful with scammers. If you got to call the academy, call. Make sure you're using the right link. There's a bunch of people with no heart and no regrets out there. So make sure that you are in our academy website. And if you have any questions, call the academy and confirm you have the right link. I'm here. This is me. I'm here live. So you don't need to risk it, okay? So call us 813-319-3603. WhatsApp. You can WhatsApp message this number, 813-319-3603. And we can explain everything about the masterclass, explain everything about the Master Next Generation 21 Days course. And I'll see you next week, okay? Thank you very much. God bless you. Bye-bye.